Hi guys, this is Charles. I'm one of the surgeons at Southpaws. I'm just going to quickly review a CT myelogram in a little dachshund that presented with ataxia and had neck pain. And so looking over here, this is him in the CT scanner. And then coming over here, we've got the CT scan and myelogram. So up here we have the brain, and this is the calcified area here is the tentorium cerebelli between the cerebral cortex and the cerebellum. Up here we can see the tympanic bullas and the ear canals here and here. Now as we head back, we can see the endotracheal tube. This is kind of brain stem right here. Heading farther back, this would be the foramen magnum. And then we can start seeing the myelographic contrast appearing in the cervical spinal cord at about C1-2. And that's a perfectly done CT myelogram. So sometimes we inadvertently get contrast up into the brain, but in this case, Nadia did a great CT myelogram, or a great myelogram, where we don't have any contrast up into the brain. Contrast in the brain can cause seizure activity after the procedure. So looking here, we've got the dens right here, which is poking from C2 up into C1. So this is the atlas right here. Now heading back, we can really clearly see contrast material surrounding the spinal cord. This would be C2, which has the very prominent spinous process dorsally, and then it's kind of a characteristic triangular shape. Now this would be C3 here, and we think that they kind of look like a possum or a wombat. Heading back to C4, C5, and then we can start seeing some deviation of the dicolon at C5-6. And so we can see the spinal cord is squashed here at C5-6, and then in the body of C6, and then back down to C7, it's back to normal. And then we can see the first set of ribs coming in here at T1. So up here you can see the ribs there, body of T1. Heading forward, this is C7. And then you'll notice that the transverse processes of C6 are very prominent. So see how they're sticking up in the air like this? So that's characteristic of C6. C7, you can see that the transverse processes are not as prominent. So that's C6. Back to C5. Disc rupture is at C5-6. C4, C3, C2 with that triangular shape. C1, which is the atlas, again with the dens sticking through the spinous process. Now let me just see if I can bring up that same scan on a multiplanar reconstruction. So just see if I can move this up to C5-6 so we can see that same disc rupture at C5-6. And then looking here, we can see the bulge. Let me just see if I can enlarge that. So now we can see that disc bulge compressing the spinal cord at C5-6. There's a better view of it there. So we've come back and we see that that's T1 down there, C7, C6, and C5. So that's the review of this CT myelogram on Ruben that has a C5-6 disc rupture, and we are taking him straight to surgery straight away. And we will see you soon.